Welcome to episode 239 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. My guest today is Commander Stephen Chang. He's a pharmacist and an officer in the United States Public Health Service Commissioned Corps. He's an advocate for public health, and during our interview, we cover a lot of ground. We discuss how he got from pharmacy school to working for the FDA, settings he's worked in, roles he's served, deployments he's been on, what he thought he'd be doing upon graduation when he was just a pharmacy student, and advice for students and pharmacists who are considering their career options. If you're interested in a career in public health, you need to listen to our conversation. But first, if you are new to the Pharmacist Voice podcast, welcome. Again, I'm Kim Newlove, the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I am a voice actor and a podcast host. I graduated from the University of Toledo College of Pharmacy with my BS Pharm in 2001. Among other things, I provide medical narration to clients in the pharmaceutical, biotech, and continuing medical education industries. I also narrate audiobooks for pharmacists, and I help pharmacy professionals plan podcasts. If you have a project in mind, whether it's a medical narration project, audiobook, or something podcast related, contact me through my website, thepharmacistvoice.com. I am a go-to pharmacist in audio production. I love what I do, and I would be happy to help you. You can also find the show notes for this episode on my website. Just go to thepharmacistvoice.com, click on the podcast tab, and find episode 239. Without further ado, here's my interview with Commander Stephen Chang. Hi, Stephen. Welcome to the Pharmacist Voice podcast. How are you?
I'm good, Kim. Thank you for having me today.
My pleasure. I absolutely love interviewing Public Health Service Commissioned Corps pharmacists. I am so glad you could be with me today.
Thank you. Appreciate it.
I'm sure my guests are wondering the same thing I am. How did you get from pharmacy school to the Public Health Service?
I get to ask this a lot from my students. They're always curious, how did you pick the Public Health Service? Well, I can tell you in pharmacy school, I had fellow students that did the COSTEP program through the Public Health Service, and they would come to school and do presentations about the program to students, which is kind of the only way that I learned about the program. I also had a mentor who was in charge of the rotations, the experiential program. He definitely highly recommended the Public Health Service. And at the time when I was in school, I really didn't know, most people want to do retail or hospital. I didn't really know where I wanted to go. So I talked to the students and my mentor, and there was an opportunity locally, which is, I'm sure you'd appreciate this. It's really strange, but there was a Bureau of Prisons near where I was living at the time in New Jersey. And so I talked to the chief pharmacist there, and they told me they had an opening. And so I was curious, and that's kind of how I landed in the Public Health Service.
As a pharmacy student who worked at a prison, that was me back in 2001, I actually had not even heard of the Junior COSTEP program while I was working there, which I think is kind of strange. But I love that we're talking about this here on this podcast so that other pharmacy students right now can hear about this and go to the website and check out the Junior COSTEP program. Now, just to summarize, what is the Junior COSTEP program?
The Junior COSTEP program is a program that the PHS manages. It's where you can intern over your school break in different agencies throughout HHS. While you are interning as a student, you actually get commissioned as an officer, and that time counts towards your retirement. It's usually for undergrads for at least 2 years of study, or master's students or doctoral students. It's pretty broad, and so you don't have to be a pharmacy major. You can be other majors and still do the Junior COSTEP program. I would highly recommend that for students. One thing I will say is people should be aware some pharmacy schools are going to 3-year programs, and so they may not have the time to do that. That's one of the feedbacks I am getting from students.
Good looking out. The students need to hear the pitfalls, things to avoid, and also the things that are good about it. One of the good things about it, I think if I remember right from one of my other Public Health Service Commission Corps officer interviews, is that once you get into the junior co-step program, it can actually be kind of the start of your process into the public health service. Would you agree with that?
I do. And I think it's a great opportunity because you can get matched to different agencies. Some you wouldn't even probably think about. FDA is one of them. FDA has tons of junior co-steps, senior co-steps, and it's one way to get exposed early while you're in school. And I think it's such a great opportunity.
Well, you went into pharmacy school, Philadelphia College of Pharmacy, right?
Hmm.
And then you graduated. And at what point did you enter the public health service? Was it immediately upon graduation?
It actually was. It was immediate because I was living in New Jersey at the time. It just happened where I was talking to the chief pharmacist and they said, we have an opening, you should come check it out and see what you think. And I did. And it's very unique because it's the only prison in the United States that is on a army base.
That is different. Not even in Colorado. They don't even have one on a military base in Colorado. There's so many prisons there.
No, no. So my understanding is that that is the only one that's a federal prison that's on an actual military base. And that was very interesting for me because every time you kind of go on campus, it's essentially like a military base thing where they would check you to have you come onto the base and then you have to get checked a second time to get onto the prison. So it was very interesting.
Yeah, boy, I'm one of those people that sometimes waits until the last second to leave for work. So you would definitely have to plan your day so that you could get through 2 security checkpoints, right?
Yes, correct.
Yes, I remember going through security at my prison and I had to take off my belt and my shoes. And this was prior to 9/11. And I think the security might have been, I don't know, different from post 9/11. But, anyways, I just remember just so many things having to have my ID. These people knew me. I came into the prison every single day. I was one of the only females. It was a men's federal correctional institution. But, anyways, I appreciate the security. And for any pharmacy students out there who are considering a similar situation, give yourself time, guys. So, anyways, you went into working for the Bureau of Prisons. Were you serving the inmates or were you helping the staff? I mean, who was your population that you were actually serving?
Oh, we were serving the inmates. Kim, you probably know this, but I was in a low security facility. There were probably about 5,000 inmates at any time. And there were 2 campuses on that site. So we had to rotate between 2 campuses. And so it's a challenging population because you're dealing with the elderly. You would be surprised, but there are elderly patients, there's young patients, and there's different ethnicities. So they come with different challenges in the prison system, which people don't think about. And so that taught me a lot while working there because you're seeing these people every day and providing them care. So it was definitely rewarding for me.
How would you say the formulary at a Bureau of Prisons healthcare clinic compares to a retail pharmacy out in the civilian world?
That's an interesting topic. The Bureau of Prisons has their own formulary. However, if the patient does need a medication that could be a brand new HIV medication, we can get that in the prison system. We can order the medications if it's needed, if the physicians order it. In my experience, I didn't have a lot of trouble. If it's something that can be a generic, we definitely will switch them when they are admitted, right? They can't get everything under the sun.
That was my experience as well. The thing that I want to make sure that the pharmacists and students, maybe technicians listening to this understand is that there are fewer bottles in the pharmacy at a Bureau of Prisons pharmacy than there are in a civilian pharmacy. Would you agree with that?
That's correct. We have a very tight supply. And so we have to monitor our supply and order every day. But it's very similar to retail, but we have a tight supply in terms of the formulary. Yep.
Right. And one of the things I have to praise public health service pharmacists because they're creative and resourceful. If there's only maybe 5 antihypertensives, they pick from among them. They don't necessarily stray from the formulary, so to speak, but you don't have to. If you have 5 medications that work great for 99% of the people, that's what you use. And I just wanted to say that it may sound like a restrictive thing, like a closed-minded thing to have a formulary and not many bottles, but using your brain is amazing in the public health service. You get challenged more. Would you agree with that? You get challenged more with clinical skills?
We do because we see, people don't think about it, but in the prison, there's a lot of emergencies that come up. People have chronic conditions. Some of them are very ill. We had patients that had cancer, HIV, STDs. People get stabbed. People have diabetes. Their diet isn't quite as the best in a prison system because of the food they're feeding them. So you have patients that have a lot of conditions that we're managing. So yeah, it's a lot of clinical knowledge that you're using while working there.
Absolutely. I don't want to dwell too much on the prison system. I just wanted to make sure that I praised public health service pharmacists for how creative and resourceful they are. The inmates really need help too. They can't just go pick a different pharmacy if the line is too long. They really need you too in the public health service. So I love what you guys do. Now, after you finished working for the Bureau of Prisons, what was next for you?
I transferred to the FDA. So my second position was with the FDA. And then I worked in sort of a data management safety side of the FDA, kind of working on epidemiology and data management. So there's a lot of safety initiatives that come up that we get tasked to answer from Congress or within FDA. And we work also to support the approval of medications if they want to query kind of safety issues that come up with other medications that are in the class, possibly that they want to compare. So it was definitely a different change from the prison.
It sounds like there was a heck of a lot less patient interaction too. You're interacting with data instead of humans, right?
Correct. It was definitely a career shift because you're more working in an office and a lot more meetings. But it was very enjoyable because you're kind of, meeting the mission of the public health service, right? We're here to serve the population, help protect the population. And so a lot of the things we're working on, even despite the fact that you're not working directly with patients, they have a huge impact on patients. Because again, you could do an analysis that could help support the approval of medication or add a warnings and precautions or add other box warnings that affect the access to them.
I love data. I think most pharmacists do. Do you get excited about your work that you do at the FDA?
I definitely it's very exciting. I would say at the same time, you're kind of thinking, wow, whatever analysis you're doing could have a larger impact. A lot of thought goes into, oh, how is this going to be perceived? How is this analysis or the work we're doing? So a lot of thought and process goes into that and discussion. It can be challenging but rewarding at the same time. So it's very exciting.
What I hear you saying is that your impact right now is really broad because you're not just impacting a prison population of 5,000, let's say, you're impacting everybody in the country who uses a medication. I think that's really interesting. Your impact is much greater with what you do now.
Yeah, so it was definitely a shift from working in the prison because you're seeing the impact, right in front of you. Your patient comes and talks to you every day. You have a relationship, but at the FDA, it's a little bit removed. However, you do see when things are released or things happen, the impact.
There are a lot of pharmacists out there who would love to no longer be in patient care. They love their patients, but at a certain point, sometimes pharmacists, especially retail pharmacists, they get burned out and they would prefer to not be face to face with a patient every day. I'm not saying that you have the cure for what ails them. However, I want to make sure that pharmacists out there know that this is an option for them. So, for any pharmacist out there who is liking what they hear and is interested in possibly doing what you do, working for the public health service and all these different settings that you can work in, would you recommend your job working for the Public Health Service Commission Corps to other pharmacists?
I get this question a lot from students. I always advocate for the public health service because you can really apply your skill sets, you can learn new skill sets. You definitely feel rewarded because you have such a huge public health impact because we get deployed, we have other roles that we serve. It's very important when I tell students to think about, does this interest you? Does public health interest you? Sometimes it doesn't. I've talked to so many students and they sometimes have they already know what they want to do sometimes. But my job is to provide them an experience so they can use that to help them in their further future careers.
Thank you for sharing that. There are so many different things that a pharmacist can do. I love that you love your job enough that you would recommend it to others.
Yes. I mean, I would definitely recommend FDA and the Public Health Service. All the other agencies are great too. We have so many dedicated pharmacists throughout Public Health Service that are serving the community. I recommend any of those positions. I think it's a great opportunity.
I totally agree. I tried to get into the public health service, but like the Navy, they said, Kim, you have asthma. That's a disqualifying condition. I totally get it. But now that I have a podcast, I'm going to make sure that other pharmacists know about the Public Health Service Commissioned Corps because I think it's just, to quote somebody that I was talking to earlier today, it's one of America's best kept secrets.
That is correct. That's our little tagline. Like you mentioned, if folks don't tell you about it, you don't hear about it unless you're in school or they talk about it. So I'm trying to spread the word. I do a lot of talks with universities about the public health service as a career path.
Awesome. I didn't know that. Can you give an example of a group of students at a university you've spoken to?
Yeah, so every year the University of California, San Francisco they have a course that they mandate that they all take in the first year of school, and all students are required to attend. And so it's probably about 140 to 200 students, depending. And so you present about your career path, about what you're doing, and then how they can pursue that career path as well. So it's very helpful for them. I do this every year because I think it's valuable for them to hear that this is an option. It's important that they hear it early on in their career so they know that versus waiting all the way to your fourth year and then you're kind of stumbling on, what should I do next?
And you have the opportunity to share the information about the Junior Co-Step program with them so that if it does catch their interest, they can experience it. And if they like it, they can continue on and later on join the Public Health Service Commission Corps. Or if they don't like it, they can say, hey, this isn't for me. And thank goodness I learned about this early on in my journey so I don't accidentally, stumble into a career path that I didn't like.
Correct.
But how often does that happen? Everybody loves public health service, right?
Yes, everyone does.
Going back to something that you said earlier, there were two things that I wanted to talk about. Number one was deployments. So we'll get into that. And then I also wanted to see if your journey through public health service employment has ended at the FDA or if it is continuing to other parts of the public health service. So first, let's talk about deployments. Can you share what's a deployment like? What's an example of one you've done?
I love talking about deployments. I'll preface that because deployments are just a great opportunity to really make a huge impact. COVID-19 is one of those examples. Many of our officers deployed on several missions, multiple missions. One of the ones I will talk about is I was deployed for COVID-19 deployment to Detroit, Michigan. of all places, I never thought I would go to Detroit, Michigan.
That's not too far from me. That's the airport that I fly out of. Okay, sorry.
Yeah, and so we set up a huge vaccination center in the, I believe it was one of those sports centers. I believe it's a football field. They essentially built a vaccination center overnight. And we partnered with FEMA and all the local pharmacies to basically staff up and stand up a vaccination center. And they put me as the officer in charge to manage the vaccinations and the pharmacy aspect of that vaccination center. It was very high profile because I believe CDC picked these sites based on their social economic status, and Detroit was purposely picked to make sure that everyone gets vaccinated in the area. And I can tell you that there was high visibility. The governor came. So the governor of Michigan at the time came and she got vaccinated. And a lot of high profile generals came, depending on who they were. They wanted to make sure that most Michiganders were vaccinated. I believe at the time that was at the height of the COVID pandemic. It was, I believe, March. And so it's very challenging because it was high volume. I would say we had about 45 contract pharmacy staff, 17 or more U.S. Air Force airmen. We had augmentation of airmen. And at the end, we vaccinated about 250,000 people in the time span of 6 weeks.
That's amazing.
Yes, I would say. And, you probably recall, Kim, but there was a change in the vaccinations, right? Johnson & Johnson had just released the alert about the adverse event for men and cardiac issues. And so it was a challenge to get people to get that vaccine. We had both the Pfizer and the Johnson & Johnson vaccine, but it was challenging to advertise and make sure people get the Johnson & Johnson vaccine. And so that we had to kind of augment our operations because of that, because we had both vaccinations and that alert came out and that impacted a little bit.
Yes, getting buy-in about safety from people who hear things from not you it can be hard. It's a challenge because people want to believe the bad stuff, even though, 99% of the time everything's okay. I got the J&J. My husband got the J&J. One of my two kids, he was old enough to get the J&J. Everything was fine. But like you were saying, it's a lot of people that need to get vaccinated, and the evidence shows that it's safe. But wow, 250,000 people over 6 weeks. That is a lot. I bet you guys were busy.
We were very busy. I think I was working 12-hour days. And being the officer in charge, you have to manage all the technicians and all the airmen, and then report up to higher level officials about the progress. How many are we doing a day? How many were wasted? Wasted meaning they had a mistake while they were drawing or reconstituting, so they would have to waste the vaccine. Or maybe there was a malfunction with the needles, right? When people are administering the vaccine, so they would have to waste whatever they didn't use. And so keeping up with all of the juggling parts was actually exciting but challenging, and making sure that everyone gets the best care and has the best experience possible. Customer satisfaction was high on our radar at the time, and we want to make sure people come in, they want to be there, they want to get vaccinated. They will then go out and tell everyone else, hey, get vaccinated. It's amazing. The operations there are great. One of the things I want to share too, which was rewarding as a public health service officer, is that we noticed there were lots of syringe malfunctions and defects with syringes. They would either break or pop out or bend. Some syringes had silicone in them or other issues. So we were documenting, and I then started communicating with people throughout the DoD to find out that, yeah, there is a certain manufacturer and most of them are seeing the same defects. And so I actually gathered the information and reported it back to FDA, which then resulted in a recall and halting of the importation of these syringes. So just to give an example of the impact you can have just being boots on the ground, being there and knowing, using the networks I have at FDA to kind of get that word out there to make sure that we don't use those syringes and the DoD doesn't pull them from the stockpile. It was actually a huge ordeal.
Good looking out.
Yes.
That's a public health concern, having, syringes that work the way they're expected to. You think that you're just going to go in and everything's going to be fine, but things come up, and good for you being able to identify a problem and address it, and probably saved a lot of other people a lot of grief.
Yes, because if they're defective, you're not going to get the effective dose, right? So it can be, it's an effectiveness issue.
Yeah, unexpected, I'm sure, but that's life, right? I mean, not everything goes as planned. And that's why you have deployments too. Who expected a pandemic? Certainly not me. What's another deployment that you were involved with?
The BP Gulf oil spill that happened quite a few years ago when oil spilled all over the Gulf, and it affected a lot of the people along the Gulf Coast. And so they deployed us to work with BP, which is the oil company. I was deployed to their headquarters in Houston, Texas. And our goal there was to help them quantify and analyze data that they're collecting on the workers that were harmed out on the oil rigs. And so they would have people, the EMTs and healthcare providers, monitoring them and their occupational injuries. And so helping them to classify those cases, allocate them, and report them correctly to the CDC and other folks that are concerned about what's going on the ground. So that was a very interesting and challenging deployment as well, because you're helping them to make sure the information is conveyed and correct.
It sounds like the population you were working with was the workers on the oil rigs. Is that what you said?
Yes, I would say, or even healthcare workers maybe that are there who are getting injured from fire burns, occupational injuries. I think when the equipment there, I think, was malfunctioning and there were fires and other issues that were happening, so people were getting injured. They may have oil exposure, things like that.
Very interesting. This is certainly not something that we learn in pharmacy school, is it?
No, it's not. And I worked with folks from the CDC. So luckily I wasn't alone. And we were working as a team to ensure that came up, that we did our job. And that was very helpful. The Surgeon General would use the information and data we're collecting to report that information out.
Very interesting. It seems like never a dull moment on a deployment, huh?
No. And one of the things that people should talk about is that we have different roles on deployments. And so you can kind of change and learn new skills on deployments. And I think it's very valuable.
When you were on your deployments, I know we only talked about two, and there have probably been more than two, but do you have to do your regular job back at wherever you were from, FDA in the DC area? Did you have to do that job and help with the deployment, or did you get a break from your regular job?
When you're deployed, and so you take time away from work, and so you focus all your energy on the deployments. Deployments are very rigorous, I will say, and so you have to devote all your attention to the deployment, because when you're there, they have lots of tasks for us to complete. There's a lot to do. I never thought for a minute that I would be running the show for the vaccination center at Ford Field in Detroit, Michigan. That was very surprising to me, and it was rewarding.
I'm sure you learned a lot too.
Yes, you really have to be on your feet. It's kind of like you apply all the knowledge that you've had working in all the places you've worked, even in the prison system, and you kind of have to just run with what you have and work with folks from different agencies, different even active duty military, and FEMA, right? So these are different agencies that operate differently. So learning new skill sets to work with them. So it was just definitely very rewarding, I would say.
I have said this comment in other interviews, but I feel like public health service pharmacists are out there saving the world. I mean, you guys were out at the oil spill in the Gulf. Who else is going to show up to help those people and lead? I know there's emergency management organizations, but you're not going to see your average CVS pharmacist showing up to the Gulf of Mexico and helping with something like this. When there's a massive need for vaccinations in a major US city, you don't see people just picking up from, Santa Fe, New Mexico, and, driving over to Detroit. I mean, you guys are saving the world. You are helping out, making a huge impact. Thank you for the important work that you do.
Thank you, Kim. I appreciate that.
You're welcome. You're welcome. I know I make it sound kind of dramatic, but really, I would not do that myself. I don't feel called to as an average citizen. But I think you guys all see this as an opportunity to lead and use your clinical skills and work with other people, and it's part of your job. And I just see you doing all these deployments. You do one and it doesn't make you want to leave your job. You're like, all right, that's over. Get back to work. Okay, another one came up. All right, I'll go focus on that now. I don't know. You guys just all kind of take it in stride. Would you agree with that?
I agree. I think, it's a calling for us. I think a lot of times people would characterize it as a calling because your mission is to protect and promote the public health of people and serving underserved communities. Whenever I talk to students, I make sure, would you like to, is that something you feel you want to do? It's definitely a responsibility that you take on. It's a career choice.
I agree. Yes. You finish the deployment, you go back to work. Have you been at the FDA for, 10 plus years? I mean, what's the path been like for you? Bureau of Prisons, then FDA. Lead me through the rest of your career here.
Yeah, I've worked in different areas because the beauty of the public health service is that you can kind of switch and change your career. I left FDA, went to the Centers for Medicare and Medicaid Services. There, I was working in the Medicaid area. Obama had passed the Affordable Care Act, and at that time, that expanded Medicaid. So what that means is a lot of people all of a sudden were eligible for Medicaid, and there was a huge push in the states that opted to expand Medicaid. And so that they needed people to help with that. And so I joined Medicaid at CMS to help with different initiatives that were part of that push for enrollment. At the same time, states were expanding their health information exchanges and their business operations. And that was very eye-opening for me because you learn kind of a different aspect of healthcare and how people get insured, how pharmacists are involved in healthcare. And so that career path was eye-opening for me because you really do work with a state Medicaid agency. State Medicaid agencies are very different. There's 50 states, or actually there's territories as well.
Right, territories
right?
too.
And so the territories and the states all have their own Medicaid programs, and CMS partners with them to run those Medicaid programs. And so with the Affordable Care Act, it was a huge, heavy lift to revamp their Medicaid programs to meet that need, to help those underserved populations. So I had the opportunity to do that. So I think it was very exciting.
When you work at the Centers for Medicaid and Medicare Services, CMS, do you work mostly with other healthcare professionals, or do you have any patient interaction as well?
I would say it depends on your position. My position, I worked mainly with Medicaid state agencies, Medicaid directors, also within CMS cross collaboratively. And in CMS, there's people of different backgrounds from like any background you can think of, they're at CMS. So the opportunities are endless at CMS. I think that's a great career path. You also learn about managed care. You learn about Medicare Part D, Medicare Part C, Medicare Part B, Medicare Part A, and you learn about Medicaid. And Medicaid is, as obviously as most pharmacists know, very different. And I wish they taught more of this in school so students would know a little bit more. I started a rotation when I was working at CMS to educate pharmacy students from the University of California schools about managed care because you don't get a lot of exposure in school.
That's very interesting. I think you're one of the first public health service pharmacists I've talked to that worked for CMS. After CMS, where did you end up?
I came back to FDA, full circle. I think understanding the healthcare landscape in terms of how people are insured and how medications are approved on the FDA side, they go hand in hand. And so I think it's a definite skill set I feel students should definitely get exposed to, and other healthcare folks to understand how our healthcare system operates. You know, FDA is great because we provide life-saving drugs and safety to protect the public. But also, you know, they don't manage once drugs are approved, they don't think about how they get insured, how patients get insured on that side, right? So having the CMS perspective helps you to understand that.
You have such a rich experience. I love it. Now, you currently are in what role?
I currently just started a new role. I'm the post-market lead in the immediate office in the Centers for Devices and Radiological Health, which is the center in FDA that manages devices and also tests, in vitro tests. I work here working on all post-market issues that deal more with devices. And so it's different than working on medications and the prescription side.
Yes, I think devices are a whole different animal. Now, did you choose that job or did that job choose you?
I chose this position because I was working at FDA, because I've worked in different roles at FDA. So I've been an epidemiology reviewer in the device side. I've worked as a lead reviewer reviewing pre-market devices. And so this was a natural fit for me to work kind of more on a higher level in the immediate office to make sure that we're communicating any safety signals that come out correctly when devices have issues with them. We work across the center. And so I think it's a great position to be, especially for a commissioned core officer and a pharmacist.
Congratulations on your chosen role. I think that's amazing that you have the experience that you can make that higher level contribution. So congratulations on finding your next place.
Thank you.
Yeah.
Appreciate that.
You've been in the commissioned corps for 15 years now. Is that right?
That's correct.
All right. In 5 years, I know you'll then be eligible for early retirement, 20-year retirement, right?
Yes, correct.
Have you thought about what's next for you?
That's always a tough question because the commissioned core is such a great career path. I have thought about it. I feel my trajectory now at FDA is a great place right now for me. So hopefully I'll still be here in 5 years. I feel this position is so rewarding. Again, you're making sure you communicate safety issues across the center and outside of the center, and you're making sure to protect people when those safety issues come up with devices. And so I don't know, actually. I guess the world could be my oyster, but right now I'm very happy with where I am.
Congratulations on being happy with where you're at, and I wish you all the best in your next 5 years. Now, I would like to kind of pivot and change the topic just a little bit and talk about geography. I know that by reading your bio, you started out in Pennsylvania, Philadelphia College of Pharmacy, and you said that you had some experience at the prison in New Jersey, and then you went to the FDA, physically located in the DC area, correct?
Correct.
At some point, you got a master's degree from the University of Washington. Did you physically work in the state of Washington? Kind of lead me through your geographic adventures here in the public health service.
Yeah, so I have a weird, I guess, an interesting kind of trajectory in terms of my career. Part of being in the public health service is you don't have to be completely mobile, but it does help you in your career. But it is definitely not something that's set in stone. I have a lot of colleagues that started their career at FDA and finished their career at FDA for over 20 years, and they've never left the DMV area. My career path is just not a typical one. And so I want people to know that, you don't have to move around. It's not a requirement. But for me, I like experiencing different areas and learning new skill sets and meeting different people from different parts of the country. And so I've traveled. I started in the East Coast. I moved for CMS and I lived in San Francisco, actually. So I was based in the regional office out there. A lot of people don't know this, but HHS has regional offices all over the country. If you work for different agencies, you could be stationed in one of those regional offices. And so those are opportunities that you can pursue. We have public health service officers that are stationed overseas. And so I have colleagues that I know that work with the international division at FDA, and they're stationed in Europe. So there are different places you can kind of work. So for this position, I was allowed to work remotely and be in San Francisco. So that is currently what I'm doing.
Thank you for sharing your geographic adventures throughout the public health service. I think it's important for pharmacists and students who are considering a career in the commissioned corps to understand that there's more than one location and certainly more than one setting. Different agencies. You've already mentioned Bureau of Prisons, FDA, CMS. You've mentioned the different cities you've been in. For someone who's young and wants to travel, or even somebody who is an adult like me, 45 years old and wants to travel, it's important to understand your options. Now, there are some people that I've talked to in the commissioned corps who want to stay in one spot, and there are some that enjoy moving around. What's your take on it?
I think people should choose what works best for them and their families. And so I like the commission corps. There are options. Some options might not be available, but they may become available later on. And so I feel that people should be open to them because they can open doors later on and you can end up where you want to be. You may not envision that in the beginning, but as you progress, I feel that you will have the option to be where you want to be. I think those doors open. They may not happen when you want them to happen. I think with any position, I feel that. I just want people to know that.
I appreciate that. Thank you for that advice. And how is your current position working out for your family situation?
Oh, it's great. I was working at CMS in the West Coast, and so I wanted to return eventually. And so now I'm able to do that. And so I think it's great for me personally. Obviously, I could remain on the East Coast if I want to. I think there's more flexibility in work, especially during COVID. So I think those options for people.
Stephen, when you started pharmacy school, what did you think you would do upon graduation?
That's such an interesting question, Kim. I think a lot of people don't know. And I think that's an honest answer. And I will tell you, I actually envisioned myself working in a hospital setting. I thought I would go through residency and then work in a hospital because I had done an internship at Johns Hopkins when I was in pharmacy school, probably in my second year. I actually envisioned myself going down that path, but then as the years progressed in school, I was exposed to other areas, which then piqued my interest. Public health service was one of them. So there were different options. So I didn't envision myself becoming a public health service officer, but as I learned about it, I definitely wanted to become a public health service officer.
I'm so glad that you could be with me today because there is at least one young pharmacist out there or a pharmacy student who needs to hear that what you thought you would do didn't become what you actually did. It's okay to change. It's okay to have an idea and to change the plan. Do you have any advice for pharmacy students or young pharmacists who might be listening to this and just have an idea of what they want to do, but might need some help having an open mindset?
Yeah, one of the things I love about precepting students is I act as a mentor. FDA has an experiential program. I'm sure if I haven't mentioned it, we regularly have pharmacy students rotating every month at FDA, throughout the year. One of the questions they always ask me is that question you posed, so I appreciate that, Kim, is, what should I do? Should I pursue a residency? Should I not do a residency? Should I do a fellowship? Something I should mention is that PHS has all those options. So if you don't know, PHS has options for you to do a residency. They have options for you to become a fellow. FDA has fellowship positions. FDA has, the Indian Health Service has residencies. FDA has other postdoctoral opportunities that you can pursue. Not knowing is okay. And I advise folks to just really talk to other people and ask them about their jobs. See if that's something you like or you can see yourself doing. I always advise them while they're going through the rotations, really ask them, what is it like for you? And usually they figure that out by the end of the rotation. Usually by the end of my rotation, they're like, Stephen, I know I want to do this. And so then I feel like I did my duty as a preceptor to help them, to guide them to that answer.
I love that answer. I couldn't agree more about talking to other people, finding out what their day-to-day is, and if you like that or if it makes you not want to do that. You got to talk to people. Great answer.
Thank you.
Stephen, are there any myths or misconceptions about being a pharmacist in the commissioned corps?
That is an amazing question. I get this question all the time. One of the myths that I want to make sure to convey to folks is that our mission is to deploy. And, as officers, that is part of our mission. And so you have to be ready to deploy, but it doesn't have to be all the time. And, we are not treated like the military or sister agencies. Their mission is different from ours. So our deployments are more public health focused. So the myth I would say is you don't have to deploy all the time. We do get breaks and we have set schedules. And so you can plan around your family life and things like that. We have set times that they tell us, like, you're on call. So you can plan around that. And one of the biggest myths I hear from students is, will they call me and I have to ship off to Dallas tomorrow? Or are they going to tell me to move? Do I have to leave my job? In the military, as we all know, they can switch your duty station at any time. They can call you and tell you you're deploying to Iraq or things like that. But the Commissioned Corps does not have that same function. And so our function is different. And so I would like to share that and debunk that myth.
That's a good one to debunk. I think sometimes people hear deployment and they do think of the military. So I'm glad you mentioned that.
Yes.
Stephen, as we start to wrap this up, is there anything else you'd like to share from your personal or professional life that you haven't already mentioned?
Yes, and I wish I had one of those cool hobbies, being a stand-up comedian. I know one of your past guests was a stand-up comedian, but I play the violin. I know this is probably cliche, but I play the violin when I started playing the violin when I was 9. And so I'm like a classically trained violinist. I once had a master class with a fiddler named Mark O'Connor. And then, also I will share that when I first moved to San Francisco, Robin Williams was, I believe, on my plane and at the baggage claim. So that was some things to share about my personal life.
How cool. You met somebody famous. Yay.
Yes. Yes. Yeah, one thing I will leave everyone with is, we have outreach opportunities in the public health service. Part of being in CMS is we did a lot of outreach for Medicare patients, and we did a lot of clinics to help with Medicare beneficiaries out in the field. And the best thing is helping them manage their medications and do Medicare Part D And I love talking to elderly folks because they're just great. They're just great people. You learn a lot. So thought I'd share that.
Well, they have a lot of life experience. That's amazing that you got the opportunity to help them and communicate with them. It sounds like you have served a wide variety of different people in different settings as you've gone through your career, from the prison to FDA, CMS, helping the elderly with these Medicare Part D programs. I think you've had an amazing career and you're not even close to finishing. So I wish you all the best in your next 5 years with the Public Health Service Commissioned Corps. And Stephen, thank you so much for being here with me on the Pharmacist Voice podcast. Take care.
Thank you.
Great interview. Thanks again to Commander Stephen Chang for being my guest today. I absolutely love interviewing Public Health Service Commissioned Corps pharmacists. They are awesome. This is my 5th podcast interview with a Public Health Service Commissioned Corps pharmacist, and it won't be my last. I'm already lining one up for either later here in 2023 or early 2024. If you missed my first 4 interviews with Public Health Service pharmacists, I've got links to the other 4 in the show notes. The guests' names are Lieutenant Commander Renu Lal, Rear Admiral Pam Schweitzer, Commander Stephanie Bagansky, and Captain Marisol Martinez. All 4 are women. I just want to say real quick, thank you, Commander Chang, for adding some testosterone to my lineup. I truly enjoyed having you on my podcast as a guest. Your career is inspiring, sir, and I really enjoyed hearing how you use your voice as a pharmacist in the United States Public Health Service Commissioned Corps. Let's wrap this episode up, shall we? Thank you for listening to episode 239 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. In the show notes, you'll find Commander Chang's full bio. You'll also find his LinkedIn link, links to the United States Public Health Service Commissioned Corps and the Junior and Senior Co-Step programs. You'll also find links to the other 4 Public Health Service Commissioned Corps pharmacist interviews I've done on this podcast, my social media links, and more. Lots of links today. Check those out on thepharmacistvoice.com. Now, if you know someone who might like this episode, especially a student or a pharmacist who's interested in public health, please share this episode with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Join me next week, September 1st, for my next drug name pronunciation episode. I love those. This is where I give you the intended pronunciation of a drug name from a reliable source so that you feel more confident saying it and less frustrated learning it. Thanks for listening today. I'll talk to you next Friday.